Hi class, in this video I'm going to show you how to set up for an incision and drainage procedure. So I have all the supplies pulled and I need to set up my Mayo stand as well as the patient. So first up, you want to make sure to clean off your hands with some Purell. Then I put on the gloves. After that I have the Sani cloth to clean off my Mayo stand so it's nice and sterile. And then I need to put down my sterile drape on the tray so I can open it up. You can actually kind of flip it over to find the end of it. So the end has that sharp crisp into it. And you want to just take it up and kind of shake it out. You want to hold it like this, not from the bottom, and then you simply lay it down on your tray. So now I have a sterile field, and I want to put all of my sterile instruments into the center of the field, because the perimeter is considered not sterile. So I need to give the doctor a scalpel, so it's a blade with a handle, so that he can cut into the cyst or the abscess to remove it from the patient's body. So I'm going to drop that onto the sterile tray. And I also need to drop down some forceps and scissors because he's going to pack that cyst or abscess with packing strip or packing material, and that helps to have the abscess or cyst heal from the inside out. And then they come back a couple days later to get removed. Let's drop those instruments. And I also need to drop down a syringe and needles, right? So I'm going to do the 18 gauge so that we can draw up the lidocaine quickly, because we have to numb the patient before we cut into them. And then we have sort of this one's a 27 gauge. You want to inject the patient with a tinier needle so as to not hurt them as much. So let's drop those so they're ready for the provider. And on top of everything, I need to put down a fenestrated drape. So this is a sterile drape, but it's got a window in it, or a hole in the center of it that you put over the patient's body to create a sterile field, and then the hole is where you can see the cyst or abscess to do the minor surgery on, or the incision and drainage. So that we're going to put on the very top. And then on the table, right, we need to put a chuck down to underneath the patient's body to absorb any blood or pus that may come out. And I'm going to just kind of move the tray over here, and I just wanted to show you, we have here's the lidocaine that we're going to use to numb the patient. And this one, you know, we have some alcohol, you would wipe it, hold this upside down with the label facing the doctor so that they can withdraw the amount that they want to inject and numb the patient. We also have down here's some sterile surgical gloves for the doctor to put on. It's very important. Another thing is you need to sterilize the abscess or cyst before the doctor does his procedure. So these are swabs. I'm just going to open it up because I wanted to show you guys. But there's 3 of them here. And just imagine if it was on here, you would go from the center out, because you're spreading the microorganisms from the inside out. And you can actually repeat it 3 times because you have 3 swabs to make it really sterile. I have 1 more swab. So I would encourage you to do that and be very liberal with it so that you create a sterile field. And we have here this is the packing material. So you open this up and this has the material that the doctor would stick into the incised area to pack it, to heal it from the inside out. And before he packs it, he'll probably also take a culture to send off to the lab to make sure that the patient is on the right antibiotic. And here are some items for the post-procedure. So we have gauze, right, sterile gauze. And I can actually use this during the procedure. This would be to, you know, if the patient's bleeding, and even after the procedure, to dress the patient. And we have here some dressing, or I could use some tape to like tape it down on their back. There's also some antibiotic ointment to put down on the wound as needed, if the doctor orders it. So when you're assisting the doctor, just have all of the supplies out and ready for him to use, and, you know, do as he directs you to do, as he orders you. And also try to anticipate his orders during the procedure so that it goes efficiently. And that is about it. If you have any questions, let me know, but thank you for listening.